My name is Linda Schellenberg. I'm the Director of Community Services at the Center for Family Support. I've been working at the Center for Family Support since the year 2000. In my current role, I oversee all of our community-based and in-home supports and services in the agency, which includes services like service coordination, respite, habilitation, day hab without walls, and our self-directed option as well. At the Center for Family Support, we provide services in the New York City area and Long Island to about 500 individuals per day, both in their home, in the community, and in our certified residential programs. We also have a presence in New Jersey. Throughout the state of New Jersey, we operate residential and day programs there as well. About 10 years ago, we were looking into electronic systems. We had previously been using paper.
The difficulty with utilizing paper versus Therap was that in the event that a staff leaves and quits, we are unable to collect 2 weeks worth of data. So that means we are unable to bill. The other reason is utilizing paper keeps you in the office, keeps you office bound, instead of providing supervision to the staff and to the participant.
When we had a paper, I showed him the services that we provided for him, but now that we have the tablet, I spoke to him about the transitioning. I talked to him about, okay, so we used to use paper and now we're using the tablet, and I showed him how to submit the information. He likes technology, so he's very into computer and stuff, so sometimes I give him the opportunity to select where we at. About the prompt, I take care of that.
Paper has its problems, paper gets lost, things get destroyed, and it's not always accurate. So we were looking into different systems and came across Therap. What we loved about Therap was that it was very robust.
Using Therap, we are able to see Therap ISP data in real time, and we're able to address things immediately.
It not only offered us the ability to enter data and to write service plans and to write monthly notes and to run reports, but it has a health module and very good communication modules and incident reporting. And so we are really at this point utilizing almost 90% of the modules that Therap offers.
I run reports on a daily, weekly, bi-weekly basis, and what that does is catches any errors, any accuracy errors, any missing data. That is compared to the time and attendance that we utilize, and we are able to quickly resolve these matters and address them in a timely manner. So external auditors are comfortable with the idea of using Therap. Our internal process now is paperless. Audit team can audit our information from wherever they are, and should they have any questions, they can contact us.
So we started using Therap in 2010 in our residential programs, and we really tapped into a lot of the robust modules that Therap offers. And a few years back, we started thinking, how are we going to roll this out for our in-home and our community-based programs where staff do not have access to an office space with a computer that they can enter data? At a Therap conference, we had learned that Therap was releasing a mobile app, and we were really excited about the possibility. And then later, at another Therap conference, we learned from another provider that they were able to work a deal with a mobile device company to get a bulk number of devices, tablets to issue to their staff, and also ways to keep the data package down. So we took advantage of that. We were able to work with a company to get the devices. We also invested a reasonable amount of money in a software that locked the devices down so that the staff could enter their Therap information on the Therap website and the app, and also time and attendance information, but nothing outside of that.
We tried the mobile app, and it was very easy. I don't have to worry about paper, the timing that I have to submit the paper, but using the mobile app, it was so easy because I was able to clock in on time, clock out, and also, adding the information, my location where I was with my participant.
We started with a small pilot of 5 individuals and 5 staff, and they utilized the mobile app along with doing the paperwork, and they met with us and gave us feedback to see how their experience was with using it, which was very positive. They liked the fact that they didn't have to drop off timesheets, that they didn't have to drop off data sheets, that they were able to do this in real time. So we decided that we had everything ready to go to really start an implementation and rolling it out with one of our big departments, our Without Walls program. And we had to develop training material. We had to hold multiple meetings where staff would come in. We also then had a need to deploy some of our more seasoned staff, which we would call mentors, to meet with staff in the field to show them how to use the mobile device. And then once we were successful in implementing the one department, we were then able to roll it out to our community habilitation program, which was bigger in size. And we are successfully now live with using the mobile app to support more than 500 individuals a day in the community and in their homes. More recently, we recognized the fact that we needed to dedicate staff resources, we needed to dedicate committee time, so we created a Therap leadership group. And within that Therap leadership group, we developed 7 different committees, and each committee has a variety of people that are involved and are charged with really looking into those specific modules to ensure that we have consistent policies, procedures, training material, so that all of the information that we have been rolling out over the years is housed in one place and is consistently implemented across the agency. And this was important because for the system to really work, we had to dedicate the time and the resources to make sure we had all that information down and that we were always taking a look at it, not just letting the system go, but being really thoughtful and informed users as well.